Now with a report on laparoscopic hysterectomy, which helps women recover more quickly. Here's our reporter, Laura Windsor.
For a woman having to undergo a hysterectomy, it's important for her to discuss the surgical options with her doctor to find out which method is best for her needs. We spoke with Dr. Allyson Brooks of Hoag Memorial Hospital Presbyterian in Newport Beach about the minimally invasive laparoscopic hysterectomy.
Laparoscopic hysterectomy is where 3 small incisions on the abdomen are used to access the pelvis and the reproductive organs to remove the uterus and cervix entirely through these 3 minimally invasive incisions. With the minimally invasive approach or the laparoscopic approach, typically patients are in the hospital for under 24 hours. They have minimal pain and can be back integrated into their normal life and work within a very short period of time, somewhere between 10 days and 3 weeks. The procedure's done in an operating room under general anesthesia, so you're asleep during the procedure. I make an incision in the belly button that is about the size of your pinky fingernail, and through that I insert a camera that's attached to a video and a display monitor. And I do a quick survey of the pelvis, looking at your uterus and tubes and ovaries and the attachments and any pathology or disease that might be present. Once I determine that you're a good candidate for the laparoscopic approach, I then place 2 additional, make 2 small incisions in the right lower quadrant and in the left lower quadrant. So in the lower abdomen, typically below the bikini line. A lot of people are concerned about cosmetics. And through those 3 incisions, we can free up all of the attachments of the uterus and or tubes and ovaries and cervix. The surgery itself can take anywhere from 45 minutes to 2.5 hours. It depends on the reason or the indication for the procedure. If we have really large fibroid uterus, it can take, just to morcellate it or break this large uterus up into smaller pieces, it can take quite a bit of time. Within the first 6 hours, their Foley catheter can be out, they're walking around the room, their pain's well controlled just with some IV anti-inflammatory medications, and typically they are more than ready to go home the next day. So it's a less than 24-hour hospitalization. The complications, fortunately, are exceedingly low when the procedure is done in the right hands. It definitely takes quite a bit of operative experience and expertise to do this, but it's similar to an open hysterectomy. I mean, we always counsel our patients about the risk of bleeding, the risk of having an infection at the cervical site, blood transfusion, or damage to other organs that reside within the pelvis or abdomen. But fortunately, all of those complications are really in the less than 3% range. Well, the OBGYN department here at Hoag has 52 department members, and we have recently expanded our women's services and have the new women's pavilion that has 6 new operating room suites that are very state-of-the-art and with the latest, greatest technology to allow us to perform these laparoscopic procedures. We have excellent nursing staff that recently received the Magnet recognition for the whole country for excellence in nursing, and those are who the physicians are partnering with along with the patients to give the best care with the least invasive and quickest recovery possible.
Understanding the options available for a hysterectomy and having a caring health provider can make this decision easier. I'm Laura Windsor for the American Health Journal.